Yes.
Is it possible to like have more of a keen sense in like say the lower part of your body than the upper part, or like kind of have it be like where you know you're better at like say walking or doing even like manipulatives with your hands, but not necessarily like moving your mouth to talk? Or
100%. There is, some kids are dyspraxic, more with global body movements. Some kids are dyspraxic more with their hands, and some kids have an oral motor dyspraxia and cannot learn to speak, although there's no other reason why they can't speak. But they can't coordinate the muscles in their lips, their mouth, their tongue, their palate to make everything move coordinated in time with the breath in order to produce sound. So you can have children who can move through space but can't talk, not because they're not intelligent or have nothing to say, but because they can't physically coordinate it. And that's a separate kind of apraxia, but they all come from the same basis, but you can have one and not the other. Why that happens, I don't know, but that it happens, I know, yes.
So like you use the example about putting your arm through a coat. Is that a learned skill that you learned the first time and then some people just remember it and they can do it? Or is it something that you're just genetically, when you're born, you can or you can't do it?
Oh, yes.
That's the same thing with her. But how do you know, like I'm with the 2.5 to 3-year-olds, if they're still learning it or they have a problem? That's the hardest part. Like she said with the coat and keeping them sit still. It's monkey see, monkey do. You know what I'm saying? So how do you know when if there's really a problem or it's just them being busy?
So like with 2 and 3-year-olds, part of the diagnosis with the 2 or 3-year-old is they're 2. They're 3. You can't take that out of the equation. But what you should see, as the child has experience, they should get better. Because nobody's born knowing how to put on a coat. Like take an infant. When you put the little undershirt on the infant, they don't help you at all. They have no clue as to what to do. But through handling and through experience and playing on the mat and looking to reach at those toys up there and through being dressed numerous times, they begin to get the idea of that push. Because they sense the shirt, they've practiced them, it's been done to them. And it's been done to them so many times that they begin to be able to help. And it's a natural process of learning as they go through this activity over and over. And then once they learn the activity, they can put on any coat and any shirt unless it's super duper duper tight or super duper big. So it's learned as the senses mature. But when you have a child who's not learning it and not getting it, and then 2, they're still limp, then there's a good chance, and they're children who can move, and do stuff. Chances are they don't have the sensation in their body to understand where their body is in space relative to other objects. And then it needs to be taught. And children who are severely dyspraxic can learn something and often can't generalize it. And in order for them to learn to do something, if any typical child needs to practice it 100 times, and children practice things dozens and dozens and hundreds, and if you remember any of your kids wanting to jump, they practice it hundreds and hundreds and hundreds of times. The dyspraxic child will take thousands and thousands and thousands of times, and that child may not be able to generalize it to something else. So that and that's what dyspraxia looks like. Very often, a dyspraxic kid has a splinter skill. They need to learn every single thing as a separate skill rather than generalizing. And that's very arduous. It's arduous for the parent. It's arduous for the child. Children get very frustrated when they can't do stuff.